The big question that many patients ask is about the next generation. So the because it is genetic, how what do we do about family planning and things like that. So the other thing is about predictive testing. So, like I said, the disease manifests only in middle age. But if I have a parent with HD, should I test myself? When should I test myself? Should I tell children that you may be at risk? When should I tell them this? These are very important burning questions which we have tried to discuss over and over again, because uh, you want to be able to help these families to cope with this problem. So there are centers that offer uh, IVF and testing alongside, so that if you have an embryo that is having the mutation, it will not be implanted. That is an option. Adoption is, of course, an option. The other thing is that you go for a natural pregnancy and test later the amniotic fluid to see whether the child you're carrying has a mutation. But these are all very complex questions which are to be dealt with on a family by family and a case by case basis, because often people think that they can handle bad news. But if you were to test somebody, a young person who is going to go to college or about to get a job, and he or she is asymptomatic today, and if you were to tell them that, okay, can you handle this, and they say yes, yes, we can do it, please, I want to know, and they turn out to be positive, it is a very difficult piece of bad news for an individual to handle. And so it has always to be done with adequate counseling where the person is in touch with the psychiatrist, because these direct to home testings where you can just mail your blood and you get the report in an envelope or in an email is very, very avoidable for these kind of disorders, because it is not very easy to handle this kind of news. Somehow the human brain seems to think that, oh, I'll probably be negative, but or if it's positive, I can handle this. But when it actually happens, it's not really so easy. So it has to be done very, very, very carefully.